put a catheter in.
Sorry.
You want to get it to a working height. Oh wait, I have to put the lower phone over.
Same here.
Okay, here's the phone. It's 10 o'clock. It's 8 o'clock in Seattle. I'm going to find out in about 30 minutes what my new grandbaby's sex is going to be. So my daughter called me. She says, "Give somebody your phone so we can call you." I said, "I have to teach tomorrow." Okay. All right. So, and you always do this with the doctor's orders. You just can't decide, "Gee, I haven't put a Foley catheter in lately, and I think I'm going to go put a Foley catheter in you. Let's go. Lay down there." No. And that's what I'm saying. A doctor always has to order this, all right? And usually for a reason. They may be going to surgery. They may be having trouble urinating. And they may be unconscious because they've been in a car wreck. So, but the doctors will always order this, all right? And Denise told you not to open your kits, to use the practice kits, okay? So I've got my kit, I've got my PPE on, and you're going to get your patient in position, and you're going to find out that Mr. Jones is really a Mrs. Jones. And you're going to have to do this. And oh, I need, Jean, could you give me some large clean gloves? I'm sorry. They're on the bottom of what? Yeah, thank you. Sorry, thank you. They're going to, you're going to clean your patient's perineal area, whether it's a male or a female, before you insert the catheter. So you're going to need some clean gloves. And you can kind of get an eyeball, and you want them to, they'll have to kind of spread their legs a little bit like this and get the knees up so you'll have a clear shot. Okay, always privacy. We use the gowns, and I know on your, it's been a long time since I've done this, because hospitals and facilities are always in a cost-conscious mode, even when it comes to using a drape and a sheet for a drape. But you kind of get a sheet, and you have to, in an ideal world it would be much smaller than this one, but you want to drape your patient. We normally use the gown, but since it's on your return demonstration sheet, I can kind of show you how this kind of works. And what we would do is have it in a triangle sort of way here, and the triangle part would go down here like this, and then you take this and wrap it around the knees, all right, so that everything's nice and private. Now I'm sure when Lawrence was out in the Crimea that this is what they did, not, but it kind of goes like this, and I'm just kind of giving you a rough, and it would be draped like this, and then you would pull it up like this, and you could move it up and down. Does that make sense? And that gives privacy. So if you are out in the Crimea and happen to have a sheet and you need to do this, this is how you would do it, okay?
You just like lock the door instead?
Yeah, you just pull the curtains around. You don't lock the door. Hospital rooms don't lock. But yeah, you want to keep it private. And now all of the facilities have private rooms, but you want to be sure the door's shut. And even in a private room, you would pull that drape around because people come in and out. And there you are. Voila! So you want to be sure that you pull the drape around, the curtain around the bed, okay? And that's kind of the theory behind that. Excuse me, sir. All right. So when you inspect your patient, you'll see that they may need cleaning. You're going to get some soapy water, a wet wash rag, a little soap, water, and you're going to clean the perineal area. Same thing with the man. You want to wash the penis and make sure to reduce the risk of introducing any kind of pathogens, no matter how clean we try to keep people. Okay, so we've got that all draped, and now you're going to open your kit. And we're going to use this as a trash bag, because when you are sterile, you don't, and you're cleaning with sterile, and you make dirty here when you're cleaning you'll see this in a minute, but when you're using your prepared cotton balls before insertion, you don't want to go back over your sterile field with something that you've made dirty. And so that's part of the whole thing. And students have broken sterile fields that way because they didn't think about where they're going to put that dirty cotton ball, okay? And so I just usually put it over here. But when you practice, you get it to where you're handy with it. Ideally, you think, well, you've got a dirty cotton ball, you want your trash down here. But if you've got your sterile kit here, you can't pass over that. If I put it down here with the sterile kit, I'd have to come around like this and do it. So for me, it's just easier, okay, to do it that way. All right, so I've got that in there. You'll always open your sterile kit away from you. You're going to grab everything out of here, all right, including the gloves and the cotton ball. And you can slide that down away so that you're not into that sterile kit. Now that's your sterile field right now. So if I need to move it, I have to move it from underneath. There weren't any sterile gloves in here, but your gloves would be there, okay? So be sure and grab your gloves and these drapes, all right, when you pull it out. All right, so now I'm going to put this down here like this, shiny side down. See, it's dull on this side, all right, and it's shiny on this side. And that way, if there's any spillage or anything like that, you won't have to change your sheets. Shiny side down, like that. And you'll put this down here. Don't worry about this, doesn't have to remain sterile because it's not going to be sterile when it goes on the bed. Now I'm going to take my clean gloves off. I'm going to go ahead and put this in here, like that. And then I'm going to wash my hands. Put my gloves on. I'm going to move that box a little bit. And I want to move that box because it's sterile, but I don't want to put my hands in there because my hands aren't sterile, so you have to go from underneath. And you can move that box wherever you want from underneath. Okay? Bugs me. And I'm going to put my sterile gloves on. Oh, this is the one for the man. If a male patient, you have a male patient, and once again, it's shiny on one side. You would take it and you would drape it over like this, okay, on a male, all right? Sorry. Put that over here by my trash. All right, I'm going to put my sterile gloves on. Got my sterile field in my sight. Sterile gloves go on the same way no matter what you're doing as far as what procedure. You always put sterile gloves on the same way, always. Be careful not to touch your gown. Fix your fingers, and now I can touch in my sterile kit. All right, in your kits, you're going to have iodine, and you're going to have another package that looks like this when you open it. It's hydrogen peroxide. And that's to clean your patient if they are allergic to iodine. You always have to ask your client, your patient, if they're allergic to iodine. So, Mrs. Jones, are you allergic to iodine? No? Okay, good. So you're going to open this, and you're going to pour it on your cotton balls, and then you're going to put it in your trash. Now, you can put it over there, or you can take it away from and drop it in your trash if you had a trash bucket down there. And if you wanted a trash bucket down there, you could use your feet. Feet are handy. And you could put it and scoot it over there, okay? You can usually think your way out of any situation. If you're sterile here, and you need to do something that's not sterile, and if you calm down and think about it, you can usually figure out how to do something, okay? So stay calm. Now, you've got your cotton balls prepared. Then you don't want to put a Foley catheter into your urethra without lubricating it. So you're going to put some lubrication there, and you're going to drop it in your trash. And then you're going to look at your Foley catheter. It is under here, all right? So the catheter bag and the catheter itself is under here. And so you're going to get it and take this. Don't put that out of your sterile field. You're going to take this off. Okay, and this takes a little practice. Leave it in your sterile kit. drop that in your trash. Don't worry if it went on the floor, you can pick it up later. Then you've got water, sterile water in a syringe. And you need to put this onto your Foley catheter, which I'm going to do in a minute, because the way a Foley catheter stays inside a bladder is you're going to put this water in a little balloon. And when you blow up that little balloon right here, and you can see this one's been used once, that's what keeps it in there, okay? And there's 10 cc's of sterile water here. So you want to put this syringe, because you're sterile, and it's sterile, you want to put your syringe onto the inflate, I think it's called, and your list on your inflate, and leave it there. In the old days, we used to test it to see if it was patent, if that balloon would blow up. But the new evidence-based practice shows that we don't want that. It can cause a risk for introducing a microbe or something, so they don't want us to do that anymore. Okay. Now, I just broke sterile field, and how did I do that?
You put your hand over there.
I put my gown sleeve over there, and it wasn't sterile. Okay, so when you are sterile, you become very aware of that. So what I should have done, since this was on this side, is I should have turned this kit around a little bit that way, and then used it from here so I didn't reach over my sterile field. Does that make sense? And I don't mind doing that. I like to make mistakes because that'll help you remember. All right? And so, and when you are sterile, I know you don't believe me now, when you are sterile, it's like this little subconscious demon comes on your shoulder and it'll tell you. You'll become very aware of what's sterile and what's not. And they'll whisper in your ear and say, oh, you just broke sterile field. Okay? So, I should have turned that around when I saw that. I don't teach this, and so I passed the first one, but I didn't pass the second. All right, so you've got your syringe on your inflate. You've got everything kind of ready here. Now you can pick up your kit, and whenever you move your kit and you've got sterile gloves on, you have to stay within your sterile field. So you're going to pick it up, paper and all, like this, hopefully, and you're going to put it here between their legs. And you're going to really hope that they don't move their foot into your sterile field, okay?
Do you tell them not to, or try to?
Yeah, well, they usually have some common sense. Because remember now, you want to keep your hands in this area right here. Now, all right, so we are ready to make myself unsterile in one area. And where do you think that's going to be?
Down.
My non-dominant hand. Okay, so this hand is going to stay sterile, and this hand is going to be unsterile. Because I have to work. I have to move that gown, and I have to spread the labia. So I spread the labia, and okay. Is that your turn, baby? All right, I've got this with my betadine on it. I'm spreading my labia, and what I'm doing then is I'm going to pick up a cotton ball, and I'm going to go down one side and clean it. I'm going to take it and drop it there.
Did you go down to the rectum or before the rectum?
No, you just go down and clean the labium, okay? Because that's not going to stay sterile, all right? You want to make this area right here where you're going with that sterile catheter as clean as you can make it. And remember, you've already washed it some. And so then you take another one, go down the other side. You take another one, go down the middle. And you can go down as far as you want. That's not. It's important to keep it clean, okay? And try to get it as clean, because it's not going to be sterile per se. Go down the middle. Go down the middle. And with this last one, you're going to drop everything in there. And where students forget is they put that tweezers back in their kit. And you can't do that, okay? So you can gently pick up that and do that. But once you're done cleaning, into the bag it goes, okay? So now I'm ready to do to insert it. And I'm going to take my sterile hand, I'm going to gel it up here where I put my KY jelly or the lubricant, get it all gelled. And now students get upset because the box is falling, it's slipping around and all of that. Don't get upset. That can go wherever you want. You want to keep this out of as clean as you can, and you don't want to